We utilize the pool for just about any type of condition. We do a large amount of outpatient orthopedic sports medicine. We're affiliated with local high schools here in the metro Atlanta area. But not only do we use it for our athletes, but we use it for our non-athletes as well. We use it for total hip replacements, we use it for total knee replacements, we use it for rotator cuff repairs, spinal fusions, laminectomies, disc degeneration, fibromyalgia. There truly really is not a diagnosis that you cannot utilize the pool for. Our clinics at Georgia Physical Therapy and Sports Medicine, we open up at 6:30 in the morning and we close at 7 p.m. So we're really open, right around 12 to 12 and a half hours of all patient care. And I would say within that time frame with multiple therapists, we're seeing probably about 50 patients, 55 patients a day. And within those 55 patients, we were probably putting about anywhere between 25 and 30 patients a day in our pool, some form or fashion. Like I said, there are times that we have 2 to 3 patients in the pool per hour based on what their diagnosis is, based on what their functionality is, based on what their independence is to be able to do that. Some of our patients are a little bit more one-on-one, some require a little bit more hands-on with it. But I would imagine probably throughout the day, it's safely to say, I would say about 50% of our patient population in a given day will get in the water. Whether that could be a whole hour's worth of treatment, it could be one of our athletes that's just getting in the pool for 10 to 15 minutes because they've got some lactic acid buildup, or they've got a trigger point, or they've got some just myofascial pain as well. But easily to say 50% of our patient population will get in the pool at a given time. Our patients, we normally will run probably about anywhere between kind of a 12 and 15% cancellation rate. Here at Georgia Physical Therapy, we run anywhere between probably about an 8 to 10% cancellation rate. I would think that would be almost directly related to the pool and the services that we provide. We've got great clinicians, obviously great hours of operation, but really I think what distinguishes us between us and our competition is the HydroWorx 500 series pool. With our first location that we had in 2006 when we put in the pool, a pretty financial undertaking, I guess is the best way to describe it. But the return on that investment, I cannot stress enough what it means to the clinic to be able to do that. To be able to get that return on investment, as long as that there is a really good, solid referral source that you have, and then you can build on top of that. We've increased, our business by adding the pool into it by about 35 to 40%. We have an opportunity as we open up clinics to be able to generate more revenue because of the pool, because of the standpoint of the reimbursement of aquatic therapy. Being able to see multiple patients at once is an extreme benefit as well from a business side standpoint. The cost of the pool in regards to the maintenance for what you have to purchase and the ongoing purchase of it, 1 or 2 patients a month is going to pay for the cost of it. All clinics can be very well credentialed, certified in every manual technique. Those are things that we have within our organization as well. But one of the things that we have that our competition doesn't is the HydroWorx pool. And that allows us, from a service standpoint, to be able to market different physicians. It allows us to bring in different sports teams. It allows us to be able to truly provide a service that our competition can't. Yeah. And truly, HydroWorx has been something that has been a great tool for us. It is a great utilization for our patients. It is fantastic in regards to the care that you can deliver by utilizing the pool. And from that standpoint, it's probably the single best choice that I've made in regards to what we can staff our clinics with is the HydroWorx pool.